Hi there, Dr. Steve Edling, and I want to talk to you today a little bit about the toxic load and why nobody has really gotten to the underlying cause of your problem, or else you'd be fixed up and healthy by now. So we've talked previously about, if you've seen any of these other videos, about the underlying cause of your problem. You may come in with whatever your diagnosis is. You probably have something else besides that is creating a complicated health problem for you, and you may just be taking drugs or trying to manage on your own, and nobody's fixed you up. So what we do to get under, at the underlying cause is look at what is causing your toxic load. The toxic load can be many different things, and it's like a hammer that's just pounding on the wall until it finally breaks through. All right, and that's what we see with the barrier systems. We have 4 barrier systems in your body: the skin, the lungs, the gut, and the blood-brain barrier. There's 4 barriers. The 2 really huge ones that really can affect your health are the gut function, so you don't have a leaky gut syndrome, and the blood-brain barrier. If you have a leaky gut, you're going to have a leaky brain, and your brain function is not going to work good. The other thing is with the bad gut is that's 80% of where your immune system lies. And if you've got bad gut health, guess what? You're going to have a poor immune system, be sick all the time. So very important that we heal the gut, heal the brain. So what are some of the toxic loads? It can be environmental things like outside exposure things, chemicals, lead, all those different things that are out there in the environment that you can't see or feel. It can be mold exposure. Your house may have some of that. It can be anything. It can be bad gut bacteria. You can have parasites in your stomach. You can have bad gut infection and not even know it. So I had an infection in my stomach. I had 0 symptoms. So one of the tests that we do for that is this test right here. This is the test that you take home. This is from Metametrix Labs. It's the Metametrix 2105. It's a stool sensitivity test. This test you do it at home. You poop in this thing, and you put the poop in these 3 different containers, shake them up for 30 seconds, put it in your freezer, mail it out overnight. Okay, you do it in the privacy of your own home. We get the results back in 2 weeks. Do you have good bacteria in there? Enough probiotics? Do you have intestinal parasites? Do you have bad gut bacteria that shouldn't be there? If you have that going on in there, that's a problem. If you have like 50% of the population has H. pylori in your gut and they don't have any symptoms, and that could be one of those driving triggers. That could be a hammer hammering down your wall, and that's not good. So and this could be the cause of your underlying problem. What's driving your adrenal glands? What's making you unhealthy? So this is one of the test kits that we use. Another test kit that we do to help is looking at your is the adrenal stress index. What's driving cortisol? Stress in your life, or physical, chemical, emotional stressors, bad gut function, poor diet, environmental hazards. All those things can drive your adrenal glands and really create problems with pain and with lack of sleep and other things like that. So adrenal health is very important. And also, if your cortisol levels are high, it's really toxic to your hippocampus of your brain, and that's not good, so it can destroy your brain. So this is a little saliva test that we do. We check your 4 cortisol levels throughout the day. In the morning, noon, late afternoon, evening. Should be your cortisol levels, which is a stress hormone, should be highest in the morning, and as the day goes on, it should decrease, and at night it should be your lowest. If it's all over the place like this, that's not good. That's a hypothalamus, pituitary adrenal axis is off. If that's off, it's like another hammer hitting the wall until the wall breaks through and you got poor health. Nobody's checked for this. We have to do this test. Next one we'll do is, are you having any food sensitivities? This is a Cyrix lab test. This is a blood draw. These 2 you do at home. This is a blood draw that we do. So we have you run up to St. Croix. We'll do a CBC with auto differential. It's like 42 different tests that we do. We're looking at C-reactive protein, homocysteine. Those are inflammatory markers that can drive cortisol also. We're looking at, are you iron deficient? How is your blood sugar? Those are some of the tests that we do with just a regular routine blood draw. And this one would have another blood draw that they'll do for this. This is your Cyrix Labs right here. You can Google them. They have a great 3-minute video about blood-brain barrier, the gut function, how important that is. Just cyrixlabs.com. Check that out. But this is the kit that we use for the Cyrix Labs. which it will check your food sensitivities. Are you sensitive? Do you have, like when you eat the food and it's creating an antibody reaction, guess what? That's making you unhealthy. That's like putting another hammer into the wall, knocking your barrier down, knocking the wall down to poor health. So we check 25 different foods that you may have an antibody reaction to. We'll do all the different gluten antibodies. There's a whole ton of them out there. We'll check all of them, not just gliadin antibody, but we'll check a whole array of those. A very cool panel to see if you're having autoimmunity. And we also have a cool panel here too, very expensive panel, but well worth it, is we can actually check different organs of your body to see if you're producing antibodies to that organ. What that means is that your cells are attacking, your immune system is attacking those organs. You don't want that, because that could be, it could really lead to poor health. And the other one we can do on that is, again, the leaky gut syndrome array 2. Very important test to see if you got leaky gut, you're going to have leaky brain. We need to fix the gut. We have a great repair bite protocol to heal that gut. So that's some of the metabolic testing that needs to be done. We do some other things too. Those are the main ones that we do. We can do some DNA testing to see if you have the genetic DNA for food sensitivity for gluten, dairy, soy, egg, and yeast. If you do, guess what? You can't eat that, and guess what? Your kids probably have a 50% chance also not having it. So might as well get their diet cleaned up too and remove the sensitivity that is driving the immune system to go haywire, which is causing you to have poor health, not just your specific condition that you came in with. It's a little bit about the testing that we do. Nobody else is doing this. There's no way, nobody else has done this. So you need to have this checked if you want to get your health back. So it's just another thing that has to be done. It's a little bit about the testing. Any other things you need to know, we can keep you informed. Give me a call, 294-3100, or you can email me at steve@dredling.com, and look forward to hearing from you.